Good morning, everyone. It's so great to be here. And I am so honored to be able to serve the state as Secretary of Health and Social Services. I similarly want to thank the members of the Cancer Consortium for your leadership in reducing the impact of cancer in our state, in my state. You're making a difference in so many lives, and we're so fortunate to have the commitment of our leadership, of our governor, our lieutenant governor, to make a difference in reducing cancer. But I also have to say, I'm just so excited about the theme for today. I am the daughter of a physical education teacher who worked at Christiana School District and retired 30 years ago. And I remember growing up and hearing the importance of the discipline and the rigors of physical activity and how that could help me along the way. And it did. It taught me so many personal lessons about how to interact with my peers, how to be on a schedule, how to just be dedicated to something that I was passionate about. And it carried through in so many ways through school and through life that I hope that we can share those lessons with other young people, particularly those who may not have access and who may not have access because they're low income or there's not something in their local area. So I hope that we continue that conversation today and really figure out how to move things forward. But that success is just part of the story, right? Today's conference is going to focus on our many successes that we've experienced as a state in preventing and reducing cancer incidence and mortality. It highlights the critical role that prevention has in our efforts. And, as a family physician who has this public health training, we know that prevention is hard, and sometimes it's hard to show that it makes a huge difference and a dent, but everything matters, and every lesson learned along the way with our patients can really reduce cancer incidence and mortality for all of us. So prior to returning to Delaware, much of my work focused on health equity, health disparities, how we really look at empowering people to reach their optimal health, whether it was through individual patient interactions or through the research and policy efforts that I was undertaking. We know that when we address these factors, these other factors that affect and influence health, the social determinants of health, which I know many of you know, we can improve personal health, the health of our families, of our neighborhoods, and the overall health of a community. To me, that's true population health, and we're fortunate here in our state to have measures, to have the Delaware Health Information Network, to have surveys that we're paying for so we can really track our progress, and I'll share some of that information today. I know you'll hear it throughout the day. Much of what drives our ability to be healthy and thrive are things that aren't tied to traditional health care. They aren't things that I learned in medical school, for sure. I knew that sometimes my patients just needed access to other things, a job, employment. They needed access to safe and reliable housing and a car that worked so that they could get to their place of employment. I also had lots of conversations about my patients who may have had diabetes or arthritis and the benefits of getting in the pool and just doing some aerobic exercise, low impact, what that meant. What did low impact mean? What did it mean to take on just a walk around the block and how much that would help their claudication, that cramping some people get in their legs? How those simple things really can make a huge difference in their life and keep them healthy and independent for longer. We know, all of you know, where we live, the educational opportunities we have, how much money we're able to make, what we learned from our parents, our family, just as I did growing up. It makes a huge difference in how we choose what we eat every day, or what exercise we take on, or the relationships that we have with others in our community and in our lives. They set the stage for our long-term health and our life expectancy. It is pretty impressive that these upstream factors really are preventable determinants of health as well. The things like poverty, unemployment, lack of health care, affordable housing, even the lack of playgrounds, recreation centers, community centers, physical education, youth programs. When we work at the root of those problems, we can prevent issues before they flow downstream and cause issues decades later. We know that those issues can lead to chronic illness, premature death, even disability. And many of these chronic conditions are preventable. We're learning more and more about the biologic factors that influence the development of cancer long-term and how we can really start to influence them now. So we know that prevention takes years. And it is sometimes hard to make a case for investing in prevention for policymakers. I'll need your help to tell that story, but it is critical. We see that return on investment, and we know it's the best way to improve health. So we have to keep telling those stories. I'm so thankful that Delaware wisely invested in the Cancer Consortium, the Cancer Treatment and Screening for Life programs, and the Cancer Registry. We need data, we need information, we need bodies that can come together and monitor what we're doing day by day. We also support these educational and awareness initiatives to prevent and reduce colorectal cancer, lung cancer, skin cancer, breast cancer, prostate cancer. I just think that our success and my background in evidence, generating better evidence, shows that screening and prevention can really make a difference in all of these areas. And the more we can do in that area, we'll continue to see major improvements. I do want to share a little bit of the success stories that we've seen in the state, because we have seen significant improvements. Many of you may know this already, but if you look at cancer incidence and mortality rates, especially among African Americans, we've seen reductions over time. So over a 5-year period, we've seen the colorectal cancer incidence rate among African Americans decline from about 40 cases per 100,000 to 50. That's a reduction by almost half the percent of African American men and about 45% among African American women. That's meaningful, and clearly our efforts are changing lives and making a difference. We also know that for lung cancer mortality rates, those rates declined by 1/3 among African American men and by 1/4 among African American women. Prostate cancer declines were seen as well by almost 40% among African Americans in Delaware. And for women, breast cancer mortality declined by almost 1/4, which is greater than the national rates, which were about 20% decline rates. So we are seeing successes. You know, I look at these numbers and I say, we can do more. We're talking about 10 patients, 5 patients. We're talking about smaller numbers. We need to continue to get people into screening programs, into diagnosis, and then ultimately into treatment. We know that the work we're doing across the healthcare spectrum is making a huge difference. And these data points reflect some progress, but we can achieve even greater success, especially as we promote and enable our prevention efforts, as we move our system and our conversation from disease and treatment to a system that really does focus and embrace health and prevention. We know we need to think more upstream, and getting there is a collective effort. It's a cultural conversation. It's a conversation with all individuals who are touching health and health care. We know that to prevent future cancer cases and other illnesses, we have to support an environment and a culture for our children in which the healthier choice is the easier choice, is the more popular choice. That's hard work, and I know all of you are doing that daily. We know the benefits of physical activity are well documented. Childhood obesity and diabetes continue to top the public health concerns, but we know that getting kids active, moving, into physical activity is one of the most effective elixirs in our prevention toolbox, not only for health outcomes, but for other areas of life. We also know increasingly, students who are more active and healthier are better learners, and that physical activity can improve student academic achievement, classroom behaviors, and school attendance. We also know that from a survey sponsored by Nemours, the 2014 Delaware Survey of Children's Health, which has been used as one of the most comprehensive tools to monitor the health of Delaware children from birth to 17, we know that watching this data and progress, we've seen major improvements. 36% of children ages 2 to 17 were overweight or obese in the state. This is based on actual data from the healthcare providers and from parents. That's more than 1/3 of our children, and we know that there are long-term consequences. We, as a state, can do better. We also know that 54% of children ages 2 to 17 consume 5 or more servings of fruit and vegetables a day. Again, with good health promotion, we can push that number even higher. We also saw some other changes that are very meaningful over a 5-year period. We've seen a decline in the number of children consuming sugary drinks. We know that there are many policy levers out there right now pushing for more kids to avoid sugary drinks. And it's declined in our state from 43% to about 37%, drinking more than 2 cups of sugar-sweetened beverages. So that's progress. We're getting there. Whatever we're doing, talking about it, is seemingly making a difference. But we need to do more. Physical activity also increased among children. From 2011 to 2014, the percentage of Delaware children in that same age group from 2 to 17 who were physically active for 60 minutes or more every day increased from 47% to 55%. Again, more positive progress, but we can do more. We also saw breastfeeding initiation increased. From that same 5-year period, the percentage of Delaware children from birth to 2 years who were ever breastfed increased from 74% to 90%. We must be doing something right. We are making progress, but we can do more. We know that for breastfed infants, those individuals in the long term are less prone to obesity, and it shows the value of working upstream. We don't know why, and we don't know how, but somehow just starting off life in the right way gives you a chance long term to be healthier. These achievements must be celebrated, but we also must do more to integrate physical activity into the lives of our children and our young people, working together in partnership. Our department, the Department of Health and Social Services, is committed to partnering with all of you, with other stakeholders in the room, because we can't do it alone. We need to do everything we can to ensure our children have a wide range of options to be active. And we know this starts at home, but we can reinforce and enable physical activity opportunities in community settings, before and after programs, child care centers, public and private schools, faith-based organizations, recreation centers. But we need to figure out ways to make these opportunities more plentiful in places that don't have access, like in our city of Wilmington, where there are many students who are living in poverty. It's a way to build healthier communities and neighborhoods, and also reduce the impact of gun violence, getting kids into positive activities, giving them hope, and giving them positive movement and mentors. We also know that there are many kids who don't have access to positive outdoor space. And we know in Delaware we have an amazing collection of local and state parks, greenways, trails that can be accessed for free or at a nominal fee. We need to get more people using those outdoor spaces, because they are quite beautiful, and they're a way for us to build healthier communities. As a call to action, I hope that all of us will leave today with one thing that we can do collectively. I hope that you'll work with me and other leaders in the state who you'll meet today to tell them why it's so important to invest in physical activity. We need to make sure that our kids in schools are involved in physical education. We need to make sure that kids who don't have access to sports programs and physical activity have access to low-income or free programs. We need to figure out how to incorporate that into the social policies and the healthcare choices that people are making. As we invest in things like wellness programs and wellness centers in our schools, how do we also link that to physical activity and opportunities for kids to have positive opportunities day by day? I thank you for your commitment and leadership in reducing the impact of cancer in our state. So here's to a day of learning, collaboration, great ideas, brainstorming, to embrace and encourage our children to be more active and healthier. It's a simple but profound building block. It's just one additional way that we can build a stronger and healthier Delaware for decades to come. Thank you for the opportunity to be here with you today.